One of the biggest mistakes I see adults over 40 make is assuming certain symptoms are just part of getting older. A little fatigue, a little dizziness, a little forgetfulness, a little shortness of breath. So they ignore them. Months pass, sometimes years. And by the time they finally bring it up, the problem behind the symptom has often gotten worse. As a physician, I have had patients tell me, "I wish I had paid attention sooner." Today, I am going to show you 5 warning signs many adults dismiss every day, and why your body may be trying to get your attention long before something serious happens. And the 5th one is often dismissed until it becomes a serious health problem.
The body rarely sends a warning sign just once. Most of the time it whispers again and again and again, until eventually it becomes impossible to ignore. The problem is that many of these warning signs look surprisingly ordinary, which is why millions of people explain them away as stress, aging, or simply being busy. Let's start with the one I hear about most. Not long ago, I spoke with a patient that I'll call Mary. Mary was 56. Every afternoon she felt exhausted. She blamed work, then stress, then aging. So she adjusted her life around being tired. More coffee, less activity, earlier bedtimes. What she didn't do was ask why she felt exhausted every day. Many adults over 40 assume fatigue is simply part of life. After all, you're busy, you have responsibilities, you're getting older. But persistent fatigue is often your body's way of telling you something isn't working properly. Sometimes it can be poor sleep quality, sometimes it may be sleep apnea, sometimes it can be nutritional deficiencies, hormonal changes, chronic inflammation, blood sugar instability, or cardiovascular issues. What concerns me is when someone says, "I've felt this way for years," because feeling exhausted every day should never become your definition of normal. Okay, ask yourself, if you got 8 hours of sleep tonight, would you actually feel refreshed tomorrow? If the answer is no, your body may be trying to tell you something.
One thing I always tell patients is this: feeling tired after a long day is normal, but feeling tired all the time is not.
In fact, feeling tired all the time can make life harder. But the next warning sign concerns me for a different reason, because many people don't notice it until they're halfway up a staircase carrying groceries or trying to keep up with activities that once felt effortless. And when that change happens gradually, it's incredibly easy to explain away. Maybe you've experienced this. You walk up a flight of stairs you've climbed hundreds of times before. Halfway up, you notice you're breathing harder. You tell yourself, "I'm just getting older." But then it happens again and again. You see, unexplained changes in exercise tolerance deserve attention. Your heart, lungs, circulation, and overall metabolic health all influence how easily your body delivers oxygen where it's needed. One question I often ask patients is, can you do the same physical activities you could do a year ago? If the answer is no, and you haven't intentionally become less active, that change matters. Your body often whispers before it screams.
Changes in physical stamina can be frustrating. But what happens when the symptom isn't in your muscles, your lungs, or your heart? What happens when it's happening in your mind? Because the next warning sign is one many adults dismiss for years before realizing something isn't quite right. You walk into a room, then stop, thinking, "Why did I come in here?" You forget the name of someone you've known for years. You're in the middle of a conversation and suddenly lose your train of thought. Now, almost everyone occasionally forgets things. That's normal. But increasing brain fog is something many adults ignore. Many factors can contribute, such as poor sleep, stress, medication effects, blood sugar fluctuations, chronic inflammation, depression, and nutritional issues. The important point is this: your brain doesn't suddenly become less important after 40.
Many people assume brain fog is simply part of aging, but I always remind patients that changes in memory deserve the same attention we give to changes in blood pressure, cholesterol, or physical strength.
Most people pay attention when their thinking starts to change, but there's another warning sign that often gets dismissed because it feels so common. In fact, millions of adults wake up with it every morning and assume it's simply part of getting older. It starts small. You take a little longer to get out of bed, a little longer standing up, a little longer recovering after activity. The problem isn't today's stiffness. The problem is where that pattern leads. Many adults assume pain is simply the price of aging, but pain is information. Your body is communicating. Occasional soreness after activity is expected. Constant stiffness every morning is different. Persistent discomfort may be associated with inflammation, arthritis, poor recovery, sleep issues, and physical deconditioning. The problem is that people move less, exercise less, and become weaker. Then the cycle accelerates. One ignored symptom can quietly lead to years of declining function.
Pain and stiffness can affect how you move. But the next warning sign on our list is different because it often lasts only a few seconds. Most people laugh it off. Many never mention it to anyone. Yet it's one of the symptoms physicians pay close attention to, especially when it starts happening more often. James laughed whenever it happened. He'd stand up. Everything would go dark for a second. Then he'd joke, "Guess I stood up too fast." What worried him wasn't the dizziness. What worried him was that it was happening more often. In fact, most people laugh it off. But recurrent dizziness can sometimes signal issues involving hydration, blood pressure regulation, medication effects, cardiovascular function, or blood sugar changes. The symptom itself may be brief, but the reason behind it deserves further evaluation, especially if it becomes more frequent or if it leads to falls. As we age, maintaining balance becomes increasingly important for preserving independence and quality of life.
Healthy aging does not mean pretending symptoms don't exist. The goal isn't to become anxious about every ache or every bad day. The goal is to recognize when your body is repeatedly asking for attention. Here is what I want you to remember. None of these symptoms automatically means something serious is wrong, but none of them should automatically be dismissed either. The biggest mistake I see is assuming it's probably just aging. Healthy aging is not the same thing as silently accepting symptoms that continue to worsen. Your body usually gives warning signs long before major problems appear. The people who do best are often the ones who pay attention early, not the ones who wait until symptoms become impossible to ignore. If any of these symptoms sounded familiar, comment below. I'd genuinely like to know which warning sign you see most often in yourself. And If you are interested in learning how to protect your energy, memory, mobility, and overall health after 40, subscribe and join our growing community, because getting older is inevitable. Declining faster than necessary isn't. See you next time.